Prime Minister Scott Morrison, 317 new cases and 2 more deaths today. We all hurt for Victoria, and now the rush to get tested.
It is 317 new cases. Stop pretending this is over. It is not over. It is far from over. The most important thing for people to do is to get tested.
A testing blitz in testing times.
Get tested. Come forward and get tested. Please get tested.
Suburban streets, a sea of medical gowns and anxious residents, shopping centre car parks, makeshift pathology wards, even schools look a little different.
Well done. There you go. Grab some sanitizer.
As infections explode, Victorians are rushing to be swabbed in record numbers, and around 1 in every 100 are testing positive.
Not quite a fever, but I feel like I have some symptoms. So I've called up work and I'm just trying to get tested.
Fear is spreading into New South Wales too as the virus's tentacles spread across the city. Authorities are frantically trying to pounce on every outbreak, from Parramatta in the west to Picton and Brighton Les Sands in the south. The Crossroads hotel cluster has now reached at least 40 cases, likely sparked by a Melbourne freight worker who travelled to Sydney.
Just got a bit of a cold and a bit of a stuffy nose.
So who should get tested?
Anybody and everybody who has any symptoms.
Associate Professor Charlotte Hespy from the Royal Australian College of General Practitioners.
If you know that you've been in contact with someone who has come down with a positive COVID-19 test, then you're even more on notice.
Symptoms, no matter how mild, include fever, chills or sweats, a cough, sore throat, shortness of breath, a runny nose and a loss of smell or taste.
So an asymptomatic carrier is a person who has such mild symptoms from the virus that they're really oblivious to the fact that they have an infection.
The test involves a swab taken from the back of your throat and nose.
Sorry.
It is slightly uncomfortable, but over in a few seconds. In Victoria, there are more than 150 testing centres, including walk-in and drive-through clinics. You can also go to a hospital fever clinic or a specialist GP respiratory clinic like this one in Port Melbourne.
At a GP respiratory clinic, there is no asymptomatic swabbing, even for close contacts. It is for people with symptoms and only for people with symptoms.
Dr Sarah Lewis from Port Melbourne Medical.
There are no queues, so we run by appointment only and people can wait in their cars. The other benefit of coming to our respiratory clinic is that people do get to see a GP.
It's really important that accessing the test, you try not to in any way spread the virus. So that's where a mask is really important. Now, if you don't have a mask, it doesn't matter. Just get a scarf.
Children of all ages can be tested, but they must be at least 5 years old if you go to a drive-through location.
We know that they're not the ones that we need to worry about, but they may well be a good way of us picking up that a family has actually got the infection because the kid has shown symptoms.
If you have symptoms, you'll be considered a suspected case and must immediately isolate until you receive your result, often sent via text. Lab processing usually takes between 1 and 3 days, but could be longer.
The more testing we do, the more reassurance we can have that we aren't missing pockets of infection in the community.
In Victoria, more than 1.2 million swabs have been taken since the start of the pandemic, 0.4% of those coming back positive, a number rising to 1 during the last week. In New South Wales, 0.3 have coronavirus, while Queensland is a distant third. Out of almost 500,000 tests, only 0.2 are positive. To put that in perspective, at the height of the first wave in New York, 50.4% had COVID.
Victoria is testing very aggressively compared to many parts of the world.
Infectious diseases doctor Sanjaya Senanaikar from Canberra Hospital.
To ensure that testing is casting enough of a wide net, the World Health Organization recommends less than 5% of tests being positive.
Anyone unsure about their symptoms can use this free online tool by Health Direct. And for more information about where to get tested in your state, visit the Health Department's website.
Testing for COVID is extraordinarily important at the moment because the only way we are going to be able to get on top of the current outbreak is to actually find all of those sneaky infections that people aren't aware of because the symptoms are so mild.
Almost 1 million are out of work, but these small business owners say it's never been harder to fill positions. They believe that for too many, job seeker is a disincentive to work.
I'm not paying somebody that doesn't want to come to work.
We've tried employment agencies, we've advertised on Facebook, advertised in store.
Nobody's bringing in resumes, they just don't want to work.
And there's employers out there that need you to work for them.
The figures today are bleak. Right now, nearly 1 million Australians are unemployed. But there are two sides to this tale of our current COVID economy. There are those desperate for work and others who seem happy to hold out their hand and stay at home. John Nixon runs the Huskisson Beach Motel on the New South Wales south coast. His business has been reopened for weeks. The guests are coming in, but he can't even find anyone to strip the beds.
We just cannot get the staff to run the restaurant and to run the motel. Run reception, housekeeping, all the way down the line.
Those on the old Newstart allowance are now receiving $1,100 a fortnight through JobSeeker. But John says he believes there's not a lot of job seeking going on.
I rang a recruitment agency the other day, a local recruitment agency, and they laughed at me. I said, yeah, that's funny because we're having the same problem. We can't get people out of bed.
John says the reason why he's even advertising to begin with is because he fired his previous staff because they didn't want to work for the JobKeeper handout.
She said she felt ill, she was sick, just didn't come back. That was it.
Down the road at Stone Grill Steakhouse and Seafood, owner Tony DeFazio says he hasn't seen anything like it in his 15 years of operation.
We put a sign on our window for 3 weeks now. We haven't had one resume dropped in. They're obviously happy with their job seeker. Why would they want to work?
We can't afford to pay what the government's paying them to sit at home. So we can't even compete.
We're definitely having a busy morning.
Amanda Webber owns Mars Pizza Kitchen in Mackay, North Queensland.
So we've actually had a number of people that we've hired or offered positions to who, then have agreed and just actually never shown up for their shifts.
Amanda's business is yet to benefit from any government stimulus. They were just under the threshold of a 30% decrease in business to be eligible for JobKeeper, so JobSeeker is like rubbing salt in her business's wounds.
There's now, even less incentive for these people to get off their couch and go and find a permanent position.
For the vast majority of people who have lost their jobs during the pandemic, this would be infuriating to hear. We have been inundated with stories from so many who would do anything for work.
I did apply for one job and there was something like 179 applicants.
This one's a big one.
For 56-year-old Kerry Curtis, it was devastating and demoralising.
It's getting harder and harder to stay positive.
24-year-old apprentice Carlos chose to keep working while some of his mates did not.
As casuals, they were earning $700 a fortnight. But now on the JobKeeper, sitting at home, they're earning $1,500.
It's become a real issue for industries with lower paying salaries, and even more problematic in regional and rural areas.
We are hearing the same thing across a range of industries, and it's disappointing.
Hospitality staff and service station attendants in high demand, but few people willing to put up their hand. But that could all change very quickly, as the federal government has previously indicated that JobSeeker and JobKeeper are slated to end in September. Economists say we should be bracing for an unemployment freefall. Chief Executive of the Council of Small Business, Peter Strong.
People who are on what they consider to be a holiday pay at the moment will find that things will change in September. If I was them, I'd be getting a job now.
In fact, you can earn some money and still receive JobSeeker.
They can get paid, they can have more money, but they also have on their CV the fact that they've got a job, the fact that they're not sitting around doing nothing.
The Treasury has been undertaking a review of JobKeeper and JobSeeker, a mini-budget due to be handed down on July 23. And with these concerns that JobSeeker is disincentivising the need to work, it seems unlikely that the $1,100 payment will stay. Yet the original Newstart amount of $550 doesn't seem like enough when we're trying to stave off an economic crisis.
We can't open up our economy at 100% because we don't have the workforce to do that.
What we really need is someone that's just enthusiastic and willing to show up and learn and be a part of our business.